precision medicine आखिर है क्या?
It's an evolving field of medicine where one size doesn't fit all.
How precision medicine improves the outcomes?
Beauty of precision medicine is the responses.
Is it affordable?
There are companies, sometimes they are government backed up, sometimes no, they are investor backed up.
What biomarkers are all about?
These are the tests, sometimes these are seen in the blood, sometimes these are seen in the tumor tissue.
How the side effects are reduced?
Sometimes the targeted therapy can have severe side effects.
Hello everyone, Namaskar. I'm Khushbu Kapoor and today we are going to dive into a very important topic, that is cancer, which is impacting millions of lives across the globe. Joining us today is Dr. Bharat Bhosale. He is medical oncologist and he is the founder director of BB Precision Onco Center. And of course, he is a senior consultant at Bombay Hospital, Mumbai. Welcome to our show, sir.
Thank you, Khushbu. Thank you for having me here.
Sir, we are going to talk about a
Sure.
very important subject, that is precision medicine.
Right.
Sir, precision medicine आखिर है क्या?
It's an evolving field of medicine where one size doesn't fit all. So previously we used to treat every patient with the same protocol, which is chemotherapy, which used to be associated with a lot of side effects. And slowly we came to know that there are certain patients who do respond to a particular treatment which causes best possible responses and least possible side effects. And the outcome started changing.
Right.
There was a time, a decade back or two, where a patient used to survive for a couple of months. They are surviving beyond a decade. So that's the impact of precision medicine. So basically it's a personalized medicine. Every patient has a unique signature and you have to treat that patient according to that
Right.
particular. And there are biomarkers we'll discuss in the near.
Right. So, sir, we can say that precision medicine is a kind of a targeted medicine, a focused medicine.
You can call it as a targeted. Then there is a immunotherapy which is evolving. There is a
Right.
cancer cellular therapy which is evolving. All these are personalized treatments. You have to segregate patients into different subgroups. And according to you, the signature, as I mentioned, which can be a genomic signature, you have to allot different patient to different protocols,
Right.
which may include targeted therapy, which may include immunotherapy, which may include combination of targeted therapy, chemotherapy or immunotherapy.
Right. So, why it is often described as the future of cancer care?
So I would like to have a little bit correction over here. It's not the future of cancer care. We are actually practicing precision medicine.
Right.
As you introduced me as a founder director of Precision Clinic,
Right.
means I'm practicing it. What future is, in the past we used to look at cancer as a deadly disease.
Right.
We are changing.
Okay.
The perception is changing, the reality is also changing. With precision, maybe in future we will be curing all the patients. And I hope, and we all must pray, that future should be very near.
So, since you are practicing in this field, and specifically in precision medicine, so I would like to know any success story of any patient that you have treated.
I'll mention that lung cancer in the 4th stages. So if I see 100 patients of lung cancer, 80% plus, means more than 80% of the patients are getting diagnosed in the very advanced stage, where the intent of treatment has always been a palliative treatment. And the median survival for those patients with the traditional therapies like radiation or chemotherapy used to be in months, not beyond a year or two. With precision evolving with the targeted, the biomarker which I mentioned, when you do a biopsy of a patient, we have an evolution in the diagnostic, where in the lab we come to know a particular patient of lung cancer carries different mutations called as EGFR, ALK-ROS. These patients, when we were not aware about these mutations, used to survive for 6 to 8 months.
Okay.
Now I have patients who had the tumor from the lung which has gone to the brain, where the survival used to be again dismal, like 4 or 6 months or less than that. These patients are living beyond 10 years.
Wow.
We have never imagined this. And they are existing with me and with my colleagues across the board. I presented this topic as a keynote lecture last week at Raipur. And I mentioned about a lady who got diagnosed in 2004 with a lung cancer going into the brain. That time this precision was in the research. We were not practicing. And she enrolled herself into clinical trial, and that lady is still alive.
That's a great news, sir. In fact, this would inspire so many people around the world who are suffering from
Yes,
brain
absolutely.
tumor, lung cancer and various kind of cancer. सर प्रिसिशन मेडिसिन की जब हम बात करते हैं तो क्या हम किसी भी स्टेज ऑफ कैंसर पे ये इफेक्ट करती है?
So you mean stage 1, 2,
Right,
3, 4.
yes.
Stage 4 means metastatic, where as I mentioned about these stories.
Right.
So precision medicine actually started with stage 4, and now we are moving from palliative intent, which is advanced stages, to curative intents, where surgery is done, there is no tumor, PET scan is clear. Still, we are implementing precision medicine.
Correct.
One thing I would like to mention: there are treatment which we offer. Now we are looking at the tumor DNA in the blood. When there is no tumor, everything is out. We are tracing it in the blood of the patient, and if those patients are negative for that biomarker, those patients are doing well. Those patients who are showing some signs of their DNA, those patients are only getting the treatment. So we are avoiding the unnecessary treatments also.
Okay.
That is also precision.
Okay. Sir, let's see, for an example, if we have two patients with the same kind of stage
Tumor.
of cancer,
Okay.
is the treatment going to be different?
Absolutely. So if we take an example of lung cancer or any tumor which we subject for a precision molecular signature, like lung cancer, as I mentioned, EGFR, ALK-ROS, and there are other mutations, or there is something called as a PD-L1, and those patients who are not showing any of these biomarkers, those patients are treated in that particular stage with chemotherapy only, and those patients showing these biomarkers are offered only tablet form of targeted treatment.
Okay.
Or if they are eligible for immunotherapy and the score which is called as a PD-L1 is very high, they are treated without chemotherapy, without targeted therapy, only immunotherapy.
Right.
And the responses are far better than the traditional therapies like chemotherapy. And those responses, once you achieve a tumor remission, means there is disappearance of the tumor from the scan, those patients maintain that situation of complete remission for years. So that is the beauty of this precision medicine.
Right. So since you have used the term biomarkers so many times, our viewers would really like to know what biomarkers are all about.
So biomarker is nothing different. These are the tests. Sometimes these are seen in the blood. Sometimes these are seen in the tumor tissue. Sometimes we use imaging modalities because AI is evolving a lot.
Right.
So we talk about AI and lot. So these are changing the way we used to diagnose the cases. What it has helped, it has made our job, and we can cater instead of one patient, the same time point, thousands of images are getting evaluated. So biomarkers help us to prognosticate. Means I can see a triaging, this patient is going to do well, this patient is not going to do well. So I can segregate the resources accordingly. And there is something called as a prediction. I can predict that this patient will do well with A treatment and the other patient is going to require a type of B treatments. So that will help unnecessary trying of those conventional therapies,
Right.
which used to be impaired. We used to give as a blanket to all.
Correct.
So now, as I mentioned, it's a personalized treatment.
Right.
Person A can get a different treatment, and person B is taking the different treatment in the same stage.
So since you have mentioned that it's a personalized treatment, is it affordable? Is it accessible to everyone?
Innovations come after a lot of research. There are companies, sometimes they are government backed up, sometimes they are investor backed up. So it takes years. When 100 molecules are into research, after that 1 or 2 molecule comes. So it comes with the cost. But the good thing is, with time, they are accessible, affordable. Like a molecule which I mentioned in 2004 used to cost beyond our accessibility or affordability, can be accessed by each and every Indian.
Wow.
And if it is very expensive, there are ways to get access. Sometimes the companies, even the pharma companies program, which is called as compassionate program, in the early phases, it is completely free before the launch. And sometimes they provide some assistance where at least significant number of patients can have access, even if the cost is more.
Okay. So you talked about compassionate program. How someone can get access to it?
So usually compassionate programs are for a shorter period. It's not for always. So suppose a new innovation comes which has an impact on the lives of the patients before their launch. No, as per the company's policy, it's not in the hands of a treating doctor or the government. They do have access after the research in the early phases, and it is very promising. Some of our patients, my patient has got no access to such molecules long back when the molecules before launching in India, we used to procure from UK, and it was free of cost. Later on, after launching, it was beyond the accessibility and affordability. But that patient survived for 6 years with brain metastasis.
That's a great news, sir.
So that's the beauty of working together with the industry and researchers, as well as the government also has to support in procuring those drugs from outside.
Right. Sir, how precision medicine improves the outcomes?
Beauty of precision medicine is the responses.
Right.
I could have loved to show you the PET scans. You have a patient who is bedridden on stretcher, and now there is an intuition. After seeing 20 years in precision, you can actually look at a patient while the patient is walking in, and you can predict that which biomarker will come up. And there was a patient, I will shortly share a story. He came from Dubai. He was a driver, then become wheelchair bound. Young fellow with brain metastasis. We predicted there has to be some predictor biomarker like ALK, and within 10 days we got the report. We gave the tablet, and the fellow started walking.
Wow.
And the scans were clear, both in the brain as well as in the lung. So that is called as a response. So it is a deeper response, faster response, and the response lasts long, which we used to see very rarely with traditional chemotherapy.
So if we compare precision medicine to chemotherapy, how the side effects are reduced?
So side effects are totally different for chemotherapy. For targeted therapy, they are different. Sometimes there are no side effects with the targeted therapy, but sometimes the targeted therapy can have severe side effects. But with the largely, if I say, they are safer. The newer targeted therapies are having no side effects that can be sometimes unpredictable. But yes, with chemotherapy, there used to be a lot of side effects like hair loss, nausea, vomiting. Those are now rarely seen with the targeted therapies. But having said that, still we use chemotherapy, and chemotherapy has changed the way you used to cure patients. That was the first therapy which came, and in the future we are trying to use less chemotherapy. But still, that is the backbone of for cure for many cancers like testicular cancer, lymphoma. Still, we use chemotherapy.
Wonderful, sir. Thank you, sir, for sharing your valuable knowledge
Thank you.
with all of us. Sir, we would like to have your last words for our viewers who would really want to know about precision medicine.
I would like to say, cancer, no end. There is always a hope. We are curing cancer patients, and that's the truth of today. In the past, there were very little therapies available, and I see the future as a promising. In near future, I feel I'm looking at it. Every cancer patient is going to get cured. If not today, in near future, definitely yes.
Thank you so much, Dr. Bharat Bhosale, sir, for being here with us, for sharing your valuable knowledge, for enlightening us with your incredible insights.
Thank you. Thank you so
very much, sir. So this was Dr. Bharat Bhosale, and we had an incredibly insightful episode. Thank you for being here with us, for watching us. This is Khushbu Kapoor signing off.